Welcome to Imaging Services Room Orientation. You may have already received some of this information with an orientation, and that's very intentional, not because we don't think that you're getting it, but it's to make you more comfortable. In education, we believe in things 7 times, 7 different ways. So once you're out on your own, you're not going to be nervous or worry about where things are because you've received the education a few times in several different formats. So let's talk about inpatient rooms. Inpatient rooms are in some ways similar to the emergency department, so we'll cover features of both. Both types of rooms have a trash receptacle and a linen bin, as seen here, and a supply cabinet. This paper you see here taped on the cabinet is an hourly rounding form. Sometimes it's by the door, and that is really just a communication method that staff on that unit use to make sure that that patient has in fact been checked on every hour. We also see the emergency lights here, so the red switch means it's hooked up to generator power. And this toggle switch is helpful to know about because it actually controls the light over the bed. So the room lights can be off, but this could still be on. And right behind the bed, we also have the call light panel. Now the call light panel is a feature that you see throughout the hospital. It's in the emergency department as well as in all of the imaging services rooms and the imaging services holding area. So the call light actually hooks into here. You see the cord plugged in. There's a speaker that the nursing units, the secretary or the nurse can communicate to the patient through this speaker. And to turn off the call light, you hit this blue-green button with the bell crossed out. There's 2 very important buttons on here that are very helpful in an emergent situation. So the red button is the rapid response team button, and that gets you the rapid response team for within 15 minutes. A rapid response is called when the patient declines suddenly or their condition changes suddenly. So examples of that would be a seizure, the patient having an allergic reaction, difficulty breathing, anything where the patient is going downhill. They may not have coded yet because that would be the code blue button, but we're just really concerned about their condition and we need lots of help in the room. That's what the rapid response button does. Now the code blue button also gets you that same response, but it's an immediate response. The call light system is set up to go to the switchboard, so it notifies the switchboard of your location so that that code can be called to you. Now, if you don't hear the code blue paged overhead immediately, still go ahead and call the switchboard if you don't hear that page or if you hear it paged to an incorrect location. You can also call the switchboard to let them know of a rapid response or code blue, and that extension is 6. You also have the capability to use your Vocera, which is call code line or dial extension 6. There is a wall panel found in every room where you can also turn off the patient call light, but there is a patient back in room button that we frequently use in the emergency department. So that's when you bring your patient back from imaging, put them back in the room. If the patient isn't on oxygen, you won't be performing a safe handoff. So you hit that button and it lets the folks over there know that the patient is back from imaging. We have some nice features on the inpatient beds, and that's a bed exit alarm. As you can see, you can pick the sensitivity of the zones seen here. And what that will do is it will actually alarm not only on the bed, but it's also hooked up to the call light system. So if that patient is a fall risk and they start to stand up, the call light will go off, the alarm will go off so that the folks on the unit know to go take care of that patient immediately. If you do imaging in a room, it's always important to check this after you've worked with the patient. Maybe you've done a portable and you've turned it off so that you could move the patient. Always remember to turn that back on because it's a very important safety feature. You can also check the lights on the end. So if you see it flashing red or orange, that means something's not set up right. And if it's flashing green, then it means it is. Every bed, inpatient bed, has a break seen here. Here's a closer look of the patient call light that hooked into the panel. Again, that big red button turns the call light on, but there's other features on there like changing the channel. And it does have a pillow speaker so the patient can hear the TV through their call light itself. Again, here is the panel on the door. Some miscellaneous items that you will find is a gait belt in every room, and that also applies to imaging services. Please use gait belts to help stand up your patient. It's safer for them and also safer for you. You see a yellow star placed on the outside of a patient's room. It's on a magnet. That means that patient is at fall risk. They will also have a yellow arm bracelet on that says fall risk. Always place a towel on the shower bench. That's for the inpatient side, but that's kind of important to know that they do that. And always have patients wear footies. So if a patient is in a wheelchair and they come down for a testing procedure and they're going to stand up for some reason, make sure that they have hospital footies on with the grips on it so that it prevents falls. Let's talk a little bit about the imaging services department itself. So in every room, we have some features. We have oxygen and suction hookup. It's also available in all of the holding area bays. And each room has a basket, as seen here. It's a little black basket on the wall that holds oxygen supplies. So you'll have tubing, oxygen tubing, a yonker, whatever it is that you may need to take care of that patient. Also, there are respiratory supplies located in the room cabinets, so please familiarize yourself with that of where those may be located in your specific modality. This picture here is taken in one of the x-ray rooms. In the x-ray rooms, it's always the lower left-hand side of the smallest cabinet. In the CT rooms, the code blue or oxygen supplies are also always located in a little blue basket. So that may differ a little bit between modalities, so please make sure you check that out and learn those as you shadow through those areas. Also important to know, in the storage area between CT and X-ray, we have these glass cabinets that have supplies in them. So we have barium, we have cleaning wipes and gloves, and the code for that is 512. We also have some supplies out by the C-arms in the cabinets out there for the folks who are going to surgery, and that includes hats, masks, and shoe covers. In the tall cabinets outside of X-ray room 5, we do have miscellaneous items like standing footboard, merchant's board, grid holders, and a lead ruler. Again, the code for those cabinets is 512. It's also where you will find additional X-ray cassette covers, the little plastic bags, as you can see here. And we also have those in the rooms and on the portables themselves. We do have slider boards that you'll see on the walls of certain rooms. Those are very nice and helpful when you're moving a patient from a stretcher over to the table. And we do have pegostats for the X-ray folks. So please make sure you use a pegostat on pediatric chest X-rays when applicable, because that really is a key to getting really quality images for those pediatrics. We do have barium supplies if you're working on the X-ray side that are in rooms 1 and 2. And again, the code for that is 512. And those should be locked at all times. So you want to make sure that you lock up your supplies like barium, but also your supplies like hemostats and anything that is sharp. And that is just a state regulation that we lock those up. You'll also find in these cabinets some cheat sheets on how to set up for your fluoro exams, how to mix your contrast, and even our contrast policy. Just helpful hints. Again, reviewing the patient call lights, we do have those in the holding area and then also in the rooms themselves, and you'll see them throughout the department. After a patient has the call lights, they are going to pick them up from the holding area. Make sure that you wipe that off with a Sani wipe and then place it back. That just ensures some nice infection control precautions. We also have several crash carts throughout our department. So this picture of the crash cart is a little bit different. The AED that we have is now a little bit newer, but it gives you the idea. So we have this located in the holding area. We have one right across from CT, and then we have one and our IR suite number 2. So anytime there's a code called, that is one way that we could potentially help that area, is to grab the crash cart and go to that room. We also have the Broslow pediatric cart. You'll watch some education on that as well. But what we need to know is if we have a pediatric code, we're going to grab this crash cart, the red one, and we're going to grab the Broslow pediatric cart because that has supplies that are specific to the pediatric population. And also, when we call a code, we're going to make sure to communicate that it's a pediatric patient. Why? Because pediatric codes are run by our PALS certified CPR friends. There are members of the code team that are specialized in pediatric codes, and those are going to be the staff members that show up for your code. Out in the holding area, we also have a supply closet that you've seen. And in that supply closet, you'll find supplies and linens that do not need to be scanned out. It is a weighted system. So when you take something off of a shelf, say if you were to pick up that bedpan there, it knows the weight is now gone from that particular section of the shelf. And it calculates that so that our friends and materials know when to come back up and restock the shelves. Now, if you grab something by mistake, there's a black bin where you can put clean supplies in. Please don't place it back on the shelf where it came from. Please place it in the black bin by the door. We also have a C-collar and a backboard available for emergencies. And again, the code for that is 512. There are bath wipes and a warmer out in the holding area. And there is also an MSDS binder out there, but you're more frequently going to see a little sticker on all the forms on the phones that say a number you can call for those MSDS forms. So it's a service we use, and you'll have a net learning on that as well. Of if you ever are questioned of do you have a safety data sheet on this particular cleaner, you could call that number and they will fax you the SDS if you don't have it with you. We have a glucometer out there in the holding area as well as a Pyxis. So if you don't work in interventional, you're not going to be using those a lot, but it is helpful because you might have someone from another department come down in an emergency situation and they might ask for these things. Now this Pyxis isn't as detailed or as full as the ones on the floors, but it is helpful to know that yes, we do have it out there so that if staff want to try to access it, they can. Out by the front desk, this little door here would actually lead right into the front desk work area with our front desk clerks. And then we have this pin hallway. Don't forget there's a bathroom there, and you can take your patients to the female or the male dressing rooms to get dressed for their actual exams. We do have gowns and pants in those cabinets out there opposite. And also don't forget that we have sharps containers throughout the department. If you see that it is 3/4 of the way full and it hasn't been changed, please go ahead and call housekeeping so that it can be changed out. And then CT has their own supply closet, and you will find a lot of gloves, contrast, and CT related supplies in that particular closet. We do have fire extinguishers throughout the department and eye wash stations, so make sure you familiarize yourself with those. The eye wash stations are going to be around anywhere where you would have contrast, so make sure if you're working in those areas you find them. And of course we have the MRI department. So the MRI department we've already talked a lot about in orientation, but just remember that those doors are locked to staff unless you're an MRI tech. Then you know the code. We have specialized wheelchairs and stretchers that can be used in those suites, along with the specialized blue and white fire extinguishers that can go into the unit. Now, when we were talking about the call panel with the call alarm, there is actually a cord that plugs into it that can be hooked up to this fall alarm. And we have these in a couple of the rooms. And what we did is we recycled these from the units. So say you're working evening shift in X-ray and the patient is in the room and they're a fall risk. You can put this on the patient as an extra precaution to make sure that that patient does not fall, or that if they stand up that you know about it. So it's always the best practice that if you think somebody's going to stand up when they're not supposed to try to stay with them. But those other patients where you're just doing it as a safety precaution, this is a really nice feature. So if the patient has this clipped on their back, there's a little clip you can see right here dangling, and then also on here again, right here. Clip that on the patient's gown, on their back. If they were to stand up, it would not only alarm in the room, but it's hooked up to the call light system. So you'll know about it in the actual X-ray and CT work area. There's a little phone with an alert on it. So everybody will know about it. It'll be dinging outside the patient's room on that call light system as well, so that staff can come and help that patient. So I hope this orientation helps you feel a little bit more comfortable. If you have questions about anything, please let me know in person.